been fascinated with TRX.
Yep.
And I even brought my TRX
Okay.
hands, so that we can.
Not gonna have time to do both, but I'm gonna work on your back then, because like I said, I want, not that I'm great, but I want, there's only one of me, so I wanna give each person at least 10 minutes, at least, alone. Sir?
That was my question.
Yeah, what's that?
Just, I would be interested in being a third party in that back
Yep.
conversation.
Yep, just, I am yours for 10, 12 minutes, just so we can get everybody some individual attention tonight. So I'll start with Makisha, because we need a little bit of privacy, not a lot, and then we'll go from there. Okay? So, we're gonna power into this. And again, any screens that I have? The last one that I passed out too was more of a review that got under something else, but, you know, anything I have, I'll get with Nathan on that too. So, let's look at a couple of things here. Okay. Building rapport in the initial investigation stage. All right. Okay. We spoke of this earlier. Again, first impression a trainer makes is the most critical. The first impression may be made in person, over the phone, or even through an email. Hey, in this class I had all three. Okay? And like I said, first impressions are important, and I try to always look squared away, but like I said, when you guys met me, gals and guys, I had the old Brett Favre thing going on, because I was just trying to get through something, so I said, I put it out there. I'm having a struggle, but it's getting better, so, you know, don't think I'm slovenly. I was doing that for medical reasons, so, and things are getting better for me, so that's cool. Old saying, you only have one choice or one chance to make a first impression, so you want to make sure it's a good one, okay? So imperative, make strong, convincing, and positive. Okay, after a good first impression, building rapport is essential. Okay, we've seen this before, right? We've seen it a couple, 3, 4 times now. Okay, must be attentive to personality styles. We spoke of that yesterday, the deliberator and so forth. Okay, and Myers-Briggs and Dr. Neil Clark Warren with eHarmony.com and all the rest of it. We deviated into that. But it's important to use a variety of interviewing techniques to clearly understand the content of the client's message. Okay? Minimal encouragers. I'm not too minimal. If I'm trying to encourage somebody, I'm going to be a pretty good cheerleader. Okay? You don't want to be the moaner though and doing all that stuff, though that gets a little weird. But paraphrasing, probing, that's not really so good. Reflecting, clarifying, informing, confronting, if necessary. Questioning, deflecting, okay? Deflecting bad things, but again, of these, encouraging, of course, there's no harm in clarifying things, gang, so nobody gets unneeded or unwanted responses. It's okay to clarify. Okay? Communication styles, okay? Trainers should select a communication style that matches the client's need and personality, as well as the situation. Preaching style, educating style, counseling style, directing. You know, it's gonna determine who you're interacting with, okay? My interactions with dorm students would be far different than my interactions with all of you here, for the most part. Again, if I know I have somebody's attention, that makes it easy. You guys are here putting out some serious cash to listen to me, and I'm honored by that. So usually I don't have to do anything out of the usual other than to try to impart some ideas. Okay? Facilitating change. Adopting healthy behavior is a complex process, and several theories have been developed to explain factors affecting lifestyle change. Okay, one model is the trans-theoretical model of behavior change. Okay, I've sent out, we're not going to beat this over the horse. Okay, you've got the formula. More important though is the health risk appraisal. exercise and physical activity are associated with some inherent risks. Gang, I'm here to tell you, statistics will show driving here to listen to me speak and interact with you is far more dangerous than what we do in the gym. Isn't that interesting?
Mm-hmm.
Skydiving. The most dangerous portion of your skydive is getting to the LZ in your car. Statistics will show jumping out of that airplane is far safer than walking across the street. Isn't that cool?
Mm-hmm.
It's fun to talk, I mean, we could talk all night about risk and the assessment of risk and all the rest of it. I'll throw one out there. What kills more people in the world than anything else?
Vehicles?
Obesity?
No. Diarrhea.
That's interesting.
Well, you're saying the world, yeah.
In the world, yep,
Bad hygiene.
yep. Everybody gets wigged out when a shark bites somebody in the backside or worse, right? Bees kill hundreds of thousands of people every year through anaphylaxis. So, you see a great white shark or a bee, percentage, who's more dangerous? Isn't it fun just to study probabilities and so forth? Amazing. But anyways, everything has risk. The purpose of pre-participation screening involved identifying the presence or absence of known diseases, okay? So you'll have varying sheets that you could give somebody. Remember, on a day pass, you're gonna do that with somebody? No. On a week pass? Probably not. You do the release and hope for the best. If somebody's buying a week pass or a day pass though, probably they're already imbued in exercise, correct? Okay? Okay, you're not gonna have a van full of retirees going to a mall shopping and go, okay, now let's go to the gym. Probably not. So again, percentages, when we sell a day pass to somebody or a week pass, no, we're not gonna put them through a battery of questions. I will say, and my staff will say, please let us know if there's anything we can help you or you have any questions though, okay? Self-spotting gear, a little bit safer. What I mean by self-spotting gear, Anna, any piece of the equipment that we're using, 11 out of the 14 are self-spotting, meaning if you let go of it, weights aren't going to drop on you, okay? So, low risk, high return. For the masses, self-spotting gear is the way to go, okay? For building a well-rounded physique, not necessarily, but again, with what we have, we're playing to our audience. They do quite well. Okay, identify individuals with medical contraindications who should be excluded from exercise or physical activity. Remember a few moments ago, the lady on the phone? I almost thought that it was what do they call it, a seminar call or something, but it was real. Nope, I heard enough things. I am not comfortable with this. Again, full of respect. I think I even said, ma'am, with as much respect as I can muster, I would prefer that you get a doctor's release before we're starting a regime with us. I've covered all the bases. I'm saying I'm trying to be respectful here. I'm not comfortable with what you've told me, okay? Detecting at-risk individuals who should first undergo medical evaluations. Again, same thing. Identifying those individuals with medical conditions who should participate in medically supervised programs. The heart concern. Okay, Anna told me, you told us about your mother. I don't know anything more than that. If the doctor says they're okay with it, though, we're okay with it. A Carbona would be a wonderful place to start, okay? And then pre-existing conditions and the like. Self-directed versus supervised exercise, absolutely, okay? The Power Q, I made reference to that before. Physical activity readiness questionnaire, okay? Even us at NMC have a form of a Power Q. I'll get you all one, okay? If someone is identified by the Power Q as having multiple health risks, a more detailed health risk appraisal should be used, okay? This is all good. If you're running a gym for profit, some steps may be cut, okay? If you're working as a personal trainer for yourself, you ask as many questions as you deem necessary, okay? Ask as many questions as you deem necessary. If you're working for someone else, maybe they don't want those question answers. Shame on them, but they're assuming the liability. But you can do the right thing if you're interacting with the person, okay? It's not outside your scope of practice to go to boss or bosses and go, look, this person has A, B, and C going on. I'm not comfortable training them. You did the right thing at that point. Okay, risk stratification. The purpose of performing a risk stratification prior to engaging in a physical activity program is to determine the presence or absence of known cardiovascular, pulmonary, and/or metabolic disease. Metabolic disease would go into the realm of somebody having metabolic syndrome, unknown weight gain, or excessive weight gain for unknown reasons. The presence or absence of cardiovascular risk factors, again, one of the former screens that I gave you, remember the screen that I showed you that I said, I asked Todd, you golf? Did I ask you that? Who did I ask that golfs?
Nathan.
Oh, Nathan, okay, my apology. Does a high score or a low score win in golf? It's the low score. Remember the risk stratification? All the pluses on the one column? That's what they mean by that, okay? That is a risk stratification. I gave you one. That's one way to look at it, okay? And then there are recommendations throughout. But remember, too many high scores, you might go, no, we need a doctor to say this is okay, okay? Our scope of practice allows to what? Somewhere down here, yeah.
Protect the public, oh,
Yeah.
that was, sorry.
Yeah, and also, yeah, get the risk from the doctor, doctor direction, there it is right behind me, about to bite me on the backside, okay? Now, is this always done? Looks great on a screen and on paper? No, it doesn't always happen. If you're in control of the game, though, I want you to do something aligned with that, okay? Oh, this is the screen that I passed out earlier. You have this in your stack of stuff, correct? Look familiar? Please tell me everybody has that. Okay. Like I said, it's like the golf score. You don't want a high score, you want a low score. If you have a high score, get the doctor's approval to do anything. We get that. Determine cardiovascular disease risk factors, okay, which the prior screen did. There's also a negative risk factor, though, for high-density lipoproteins, HDLs. See, that'll take a point away. Cool? Yeah, okay. Anyways, determining the risk, the total number of risk factors, okay? The trainer should sum the risk factors and use the score to stratify the client's risk. Okay? Low risk, high risk, or moderate risk. Low risk, okay? Less than or equal to 1. Greater than 2 or equal to. High risk or more. As you can see quickly, it doesn't take long to get into moderate and high risk. Remember, no one is absent from risk. Life's lottery gets you at least a score of 1. Okay? Signs and or symptoms of disease. Signs or symptoms are also included in risk stratification, but must be only interpreted by a qualified licensed professional. Okay? Of course, we have Nathan in-house, so he can help us with some of these. Okay? Pain or tightness or discomfort. Okay, remember angina is referred to as heart pain. In the chest, neck, jaw, and arms, or other areas that may result from ischemia. Okay? Dyspnea. I think that is, oh God. What is it? I'll come back to that. Orthopnea, or paroxysmal nocturnal breathing disruption. There we go. I'm sorry. Breathing disruption. Ankle edema, fluid gathering around the ankles and lower extremities. Palpitations or tachycardia, heart. Intermittent claudication. Okay, that's when you might see. Claudication is cramping generally in your lower superficial compartment, the gastroc, soleus, and all the like. Okay? Known heart murmur. Very common, gang. Unusual fatigue or difficulty breathing when usual activities. Okay? Dizziness or syncope. Okay? Clients reporting any of these signs or symptoms should be referred for medical evaluation. Okay, gang, a known heart murmur, again, you should have a doctor sign off on it, but a lot of people have a heart murmur. My Jan has one. You know how you can usually tell if somebody has a heart murmur? If, when they go to the dentist, they pre-medicate with penicillin. Anybody heard of that? Okay. Well, here, I'll tell you one right now. When I met Jan, she told me she had to go to the dentist. I wasn't rifling for her purse. There was a thing of penicillin on the kitchen table. Hey, hon, do you have a heart murmur? Yeah, how'd you know that? I know you're going to the dentist and there's some penicillin. Okay, what happens? Anytime you get your teeth cleaned even, it's a very invasive process and usually some bleeding results. We all know that. Hopefully not a whole lot if your gums are relatively healthy. Well, at the gum line, okay, mouths are really dirty places. You've heard that, correct? When they're scraping off tartar and plaque, a lot of that can be a deadly bacterium, gets in the bloodstream, the heart murmur, blood's pooling behind the valve. It can then get a start there and you can get an infection in your heart. So, that sound weird? So, if you know somebody is taking penicillin or some antibiotic, what they call prophylactically, you can usually determine that they might have a heart murmur. No big deal. Happens all the time. They live normal lives. Jan goes and runs and stuff. There's no need to fix it. Remember, gang, some people like, they doctor shop and get all kinds of surgeries. I'm of the mind if they don't have to take a scalpel to you, you're all the better for it. I think we all are in the classroom here. But anyways, evaluation forms more. Informed consent or assumption of risk. Okay, get a lot of these when you do a skydive. Sign about 24 of them. Or doing some what we call saturation diving. Diving where you know you're going to be going into a decompression situation. You sign your initials all over the place, okay? Also use prior assessments and provides evidence of disclosure for the purposes, procedures, risk, and benefits associated with assessments, okay? Looks nice on paper and a screen. Again, in real life, does this happen? Usually not so much. You get a release of liability if you're lucky and you move on. So again, when you're working for somebody else, it's not outside your scope of practice to go, hey, what kind of insurance do you have, okay? And two, are you doing anything to mitigate risk? Limitations, not a liability waiver, and therefore does not provide legal immunity. Intended to communicate the dangers of the exercise program or test procedures. Trainer should also verbally review the content to promote understanding. Hey, anybody see the car commercial where the cars are weaving in and out and the little thing at the bottom of the screen? Professional drivers on secure course, do not attempt. That's what living in America does for us.
Covering her butt.
Yeah. Hey, I've been to Mexico a couple dozen times. People hardworking. The lawnmowers don't have big signs that would say, hey, don't stick your foot under the lawnmower deck, you might cut your foot off. A lot of these things are typical to America, because other people get it. Don't stick your hand under the lawnmower, you might cut your hand off your foot. Okay, now, release of liability forms, always important. Used to release a personal trainer from liability for injuries resulting from a supervised exercise program. Represents the client's voluntary abandonment of the right to file suit. Does not necessarily protect the personal trainer from being sued for negligence. okay? If you're negligent, it doesn't have any good. What if they sign it anyway?
You're grossly negligent, I don't think it would hold up.
No, this is a contract. There's an attorney.
Mhm.
Anybody can sue you for anything. A piece of paper is not gonna stop that bullet. Keep that in mind, gang. You can do everything right and still get sued, but having the release of liability in place might help protect you, okay? Education helps protect you. Insurance most likely and most certainly protects you, and all of these things. But don't, if you've developed a really nice lifestyle or have some things, some savings, what have you, don't let somebody take them away, because there's people out there that look for people to sue. It's sad, but it's true, okay? Okay, health risk questionnaire collects more detailed medical and health information beyond the coronary artery disease risk factor screen. Okay, we have a little one with NMC. I'll pass one of those out tonight, so you can just see what I get from people when they join our gym, okay? Okay, exercise history and attitude questionnaire. Okay, again, gang, good on paper. I don't know too many people that get into these things, okay? Usually, if you're just doing an interview with a prospective client, you're gonna be getting this in your head, rather than, again, you get too many forms out, somebody's gonna go, hey, wait a minute, I don't know if I wanna do this or not. Don't kill them with paperwork, get the stuff you need and move on, okay? Evaluation forms, okay, the release form we did speak of earlier. It's very good to have if any red flags come up to you. And again, if you ask for it nice, there's usually no problem. Remember, that doctor can be helpful too if you can't derive a resting heart rate from your client due to your inexperience, or you can't feel the pulse. I forgot to mention it, Tony. A good part of the time, I've known him a long time. I've had other personal trainers try to get his pulse and they can't find it, okay? So, you gotta know your client. So if you can't find a pulse, that doesn't mean you're a dummy. It means you're not experienced enough, or they have a weak pulse. Not weak heart, hard to find. Their veins and arteries might be set in differently, okay? Okay, I've only had a couple of people that I can't get a pulse on, and those that I couldn't, they were morbidly obese and my blood pressure cuff didn't work, and I wasn't sure what I was feeling, so I was pushing so far in to them. I don't know if I was getting my own pulse back on my fingers. Does that make sense? Chris, what I was saying here, sometimes getting a pulse on somebody, it's usually quite easy to do, but it's not always perfect. If you have a morbidly obese person, you can think you're taking their pulse and you're getting yours back.
What's your opinion on doing that manual like that versus electronics?
Oh, whatever you're comfortable with and whatever you can derive a reliable result in. I've only known Nathan as long as you have, but his experiences and his licensure is much higher than mine. I'd trust him getting that. I'd trust me getting, oh, sorry. Ooh. I'd trust me getting it too, because I've done it so many times in my life, okay? But if I'm in doubt, I'll put a blood pressure cuff on somebody, so why guess? Did it take me any more time? Maybe a minute or two, and I get what I need, okay? Like I said though, on a prior screen though, got the doctor there. If you can't find a resting heart rate, if your client's wanting to play ball with you, which I hope they would, they'll call the doctor and get the resting heart rate off of their chart. Is it perfect? No, but it's better than nothing, isn't it? Gives you a starting form, or starting place. Inherent risk related to physical activity. We mentioned this numerous times. Overall absolute risk in the general population is low, especially when weighed against the health benefits of regular exercise, okay? Injuries related to physical activity usually come from aggravating an existing condition or precipitating a new condition. The primary systems of the body that experience stress during physical activity are, of course, cardiovascular, respiratory, and musculoskeletal. A complete health history helps to ensure that each client gets the most benefit from an exercise program with the lowest degree of risk. Okay? Like I said, sounds good on paper, not always done though. Okay? You know what they didn't mention? What I find is extremely important. How about an emergency contact number? Did they mention that? Nope. Get that. Of course you're gonna have contact information for your clients, especially, hey, we had winter from hell, right? My car didn't start. You gotta contact that person, right? What if they go down? Of course you're gonna activate 911. They're passed out. Okay, Tamla, I'm gonna tell you a scary one. Maybe Norm told you about it. No fault of Norm's at all. Did they ever mention the lady that had the aneurysm on the leg sled? It's no fault of anybody's. She had the time bomb in her brain. Okay, fortunately, Norm knew who to call, though, when he called 911 immediately. But yeah, no fault of Norm's at all, but that's how bad it can get. That's a potentially life-threatening situation. Not to mention the sled came back on her. Okay? She made a complete recovery and the joy to be around. I forget her name, but I could point her out to you. But Norm did everything right. But again, he had that emergency contact number also. So make sure you get that. Okay? Not just for your client, but again, if the client can't respond for his or herself. Okay? Angina, that's another usual name for chest pain, but it's a pressure or tightness in the chest, but can be also experienced in the arm, shoulder, or jaw. All right, we're gonna do one-on-one now for a while, gang. So I'm gonna hold the slides there, okay? So my first victim is Makisha. I need everybody to get your things. Make yourself at home in the gym, and I'll just be a few moments with Makisha, and then I'm gonna move on to my next person, okay? That sound good?
Oh, we don't get to watch?
Well, the women can watch. Men have to leave though. It's just, it's part of professional
I'm just
courtesy.
teasing you.
I
Put you on
would-
the spot. I would love to see how exactly he's doing it, but
That's
I won't do
fine.
that to you.
You're fine, I don't care.
Are you sure?
I'm on my
take
radar
it
here.
too, so.
I just
Yeah.
didn't see when he did it before, he just kind of went
Yeah,
behind the
it
guy.
was-
We didn't actually see
yeah.
how he was.
That's more, I mean,
You're probably
like I said, I really
one
wanna know what
percent.
mine is, but.
Oh, I don't